Good morning to one and all. Welcome to Raw Online. I am Dr. Jay Kumar. Today I will take you through on the topic anti-anginal drugs. So the competency we are going to discuss here, describe the mechanism of action, the doses, side effects, indications and contraindications of drugs used in ischemic heart disease, most common thing angina and as well as the myocardial infarction. So at the end of this session, the MBBS students shall be able to classify the various anti-anginal drugs and they should be able to discuss the mechanism of action, uses and adverse effects of nitrates, which is the main prototype drug that is used in treat angina. And apart from that, there are different categories like beta blockers, calcium channel blockers, and there are some newer anti-anginal agents also there we are going to discuss. And the main thing is the beta blockers, the rationale of using beta blockers in angina, and similarly the potassium channel openers like nicorandil. So we are going to discuss about briefly on those aspects. And finally, we will discuss about the management of myocardial infarctions, which is very important in. So first, the physiological aspect, what is angina pectoris? So angina pectoris is nothing but it is a sudden severe substernal chest pain, or it may be a heaviness. The patient might feel a little bit of heaviness in the chest while on exertion, and this pain can radiate in the left side of the arm or the neck or the jaw, and it is relieved by rest. So it is a typical case of classical angina is called as exertional angina. Only it comes on exertion, and when they take rest, it will be settled down. So that is a classical angina. And the next variety is the Prinzmetal's angina, where it is called as vasospastic angina or variant angina they used to call. That means the name itself suggests it is a vasospastic. So the coronary vessels suddenly it goes into spasm. Therefore the blood flow will be decreased. And that is why it is producing the angina symptoms, which is very important. And then the third variety is the unstable angina, which is called as acute coronary syndrome. So we will just move on into the brief about these three different types. What is the problem behind that or the pathology behind that? So as I said, classical angina is otherwise called a stable angina. Only it comes in on exertion. So what happens during exertion? The cardiac myocardial oxygen demand will increase. That means the force of contraction, there will be increase in the heart rate as well as the force of contraction. So naturally the oxygen demand will increase to the heart. And apart from that, it is coupled by a fixed narrowing of the coronary vessels. There will be some sort of block in the coronary vessels because it may be due to the formation of the deposition of the cholesterol plaques forming a atheromatous plaque. Okay, so the vessel wall will be narrowed. So these two combined together will produce a chest pain, which is a classical angina. And this can be relieved by rest or the medications which we are going to discuss in the further slides. So this is a classical angina. Coming to the variant angina, Prinzmetal's angina, otherwise it is called. This because of the vasospasm, that is the coronary undergoes vasospasm. So sudden decrease in the the blood flow will be stopped. So as a result, what happens? It may be there might be atheromatous plaques as well, but mainly due to the coronary artery vasospasm. And this particular variant angina, that is why they can cause sudden cardiac death, maybe one of the reason. And it is mainly relieved by giving the coronary artery vasodilators. This is for the first two types. You can see the coronary artery caliber here in angina. Like for example, this is a normal blood vessel, okay, and this is a lumen. At rest, what happens? The blood flows normally. This is a conducting vessels. What happens in exercise? When exercise, there will be an increase in the heart rate as well as increase in the force of contraction. So naturally the oxygen demand will increase. So ultimately the end thing is more oxygen should be supplied to the myocardium to work better. So naturally the blood vessel they dilate during the exercise and the flow will be increased to maintain the demand. But what happens in the resistance vessel? This is a coronary, that is a conducting vessels which is present on the epicardial surface. But at the same time, what happens to the resistance vessels? That also will little bit dilate to allow the increase in the blood flow. This is what the normal physiological things happens during exertion. But when in case of classical angina, you can see a atheromatous plaque which is narrowing the lumen of the coronary artery. So in that case, what happens? The blood vessel wall which is not able to dilate, since it is a narrow lumen, the flow is not increased. And as a result, there will be ischemia will occur, which is leading to the chest pain. That is what classical angina. So when at rest, what happens? The heart rate comes down, the force of contraction also comes down, so the oxygen demand will slightly come down, and thereby the chest pain will be relieved. This is what happens in classical angina. But variant angina, as I told you, there is a spasm of the coronary vessels. Sudden tight, it will close. The coronary vessels will get closed. So as a result, complete blood flow will be stopped and leading to chest pain, and one of the reason for sudden cardiac death. So this is what happens in the coronary artery. The caliber